New coronavirus cases in Massachusetts hit a record high this weekend. For the first time ever, more than 7,000 cases on average are now being reported daily. Hospitalizations in the state are also ticking up, but most importantly, below where they were a year ago, before most folks got vaccinated. Joining us now from Boston, Dr. Ali Raja. He's the Executive Vice Chairman of the Emergency Medicine Department at Massachusetts General Hospital. And Dr. Raja, thanks so much for joining me. Your team at Mass General just had, I think, what was termed as the busiest Christmas ever. I guess, can you tell us what you're seeing on the ground right now in this moment of the pandemic?
Bill, you're absolutely right. Our prior record for Christmases was 270 patients in a day, which is pretty busy. We saw almost 340 on Saturday, and it was a combination of so many things. Nobody wants to be in the emergency department on Christmas, and I can tell you there's so many sad stories I've had to tell people and their families over Christmas. But this Christmas was so busy because of the fact that we also had, in addition to the usual volume, so many patients who were coming in for testing because they just couldn't find tests anywhere else.
It's astounding that we're in this moment 2 years into the pandemic, and that's one of the things you're dealing with. Can I ask, one of the things that I've been trying to get my head around over the course of the last couple of days is the idea of incidentals, kind of positives, right? Where folks are coming in with something other than COVID-19, they take a test upon arrival because they have to, and boom, turns out they're positive. Is there a way to kind of calculate how many cases you're seeing that are because of that, as opposed to admissions because they feel like they're really sick due to COVID?
There is. We classify those patients as either having primary COVID, meaning they're being admitted to the hospital for their COVID. They're coming in short of breath, their oxygen saturations are low, they need to be admitted because of COVID. Or patients with secondary COVID who are coming in with a broken hip or a gunshot wound or a heart attack and need to be admitted to the hospital, but then we find out they have COVID when they get to us. Right now, it's about a 50-50 split of patients who have primary COVID and secondary COVID. But I have to tell you, the impact of both populations is pretty significant. Even if a patient isn't coming in for COVID themselves, we still have to don full PPE when we're going in to do anything from do a physical exam or take them food for lunch after they've had their hip repaired. And so the impact on the staff is still really significant, regardless of whether or not COVID is the primary reason or the secondary reason that they get admitted.
It brings up something that I've been thinking a lot about. How's your team doing? How's your staff doing in this moment, which it seems like it's been a perpetual state of high anxiety, emergency, 24/7 now going on 2+ years?
Well, I have to tell you, Phil, I've got an amazing team. They can work through anything. The Boston Marathon bombing, so many big, busy things that we've all been through together. But 2 years is a long time. Disasters take a day or a week at the most. This has been 2 years of just constant drainage. And the thing is that now our staff are dealing with, on top of surging patients and more patients at work, they're also dealing with things at home, right? There's breakthrough cases in family members. There's kids who haven't been able to go to school. This week is a holiday week, but next week kids are going to need to go back to school. And if they're out because a classmate tested positive or something, our staff have to try to arrange sitting or try to take care of them. I'm dealing with that with my family too. So it's not just the work volume and the crushing just number of patients who are coming in. It's also everything that's going on in the rest of society that makes it really hard to be a healthcare worker these days.
Yeah, I can't even imagine. We're grateful for the work that you guys are doing, particularly in this moment in time. I know how difficult it is on you and your team. Thanks for sharing your time, but more importantly, thanks for all the work you guys are doing.
Thanks for having me on, Phil.